Deep breath in here, all the way up. Drop that shoulder. Good. Goes right through there. Yeah, good. And right through here. Yep. Nice.
What's up, everybody? It's Bella here with Dr. Brady, your local Towson chiropractor, and he's gonna run me through a couple adjustments and some nerve flossing to fix my.
So Bella, let me start off by saying, when did this happen, and what is happening?
So I think it's originally from the car accident that I had back last August.
Okay.
But I started doing yoga and Pilates this past week and a half-ish, and I've noticed a lot when my hands have to be out like this or up like this, I just kind of feel them get really fired up.
Okay, gotcha. How about sleeping? Any numbness at night, that kind of thing there? Okay.
Not that I notice.
Do you feel a line of pain traveling down from your neck down into your hands then? Okay.
More so on my right side though than the left.
Okay. Is there a position, I see you moving your head a little bit, is there a position that really bothers it? So when you bend your head to the left, do you feel it on the right? Okay. And vice versa with the other side as well then? Okay. So I'm going to take you through a range of motion exam, what we would see if this problem presented to us in the office here. So Bella, can I just have you, relax those arms by your side, look straight ahead at me, rotate your right, your head over your right shoulder. There we go. And same with the left. With your arms down like that, do you have any pain, discomfort, anything traveling to the shoulders or down the arm? Good. All the way back for me. Good. Any pain or discomfort with that movement? Good. All the way down. Tuck that chin into your chest there. Any pain, radiation with that there?
No.
Okay. Look straight ahead at me. Adding compression here. Any pain, discomfort? Good. Good. Same position. Extend.
A little bit.
I'm not a happy camper with that one right there.
Not too happy.
Good.
Not too happy.
Okay. Was there a side that was worse than the other there?
The right side when you went like this.
The right side.
Yeah.
Okay. Next, I would want to rule out any disc herniation, any nerve compression, that kind of thing there. So Bella, go all the way up just like this. We're going to see how strong you are, okay? So I'm going to add this resistance right through here. Pressing down. Good. Any pain, discomfort with that? Good. All the way up like this. Push into my arm right here. Come on. There we go. Same thing on this side here. Sweet. Now I'm going to try and pull down.
You can have it.
Awesome. Very strong. Yeah, good. All right. Like you're riding a Harley, okay? And all the way down. Good. Flip them on over. Good. Good. And say someone did have a herniation there, just for video purposes, I'd be checking side to side here. So if it's a lateral, say this is strong here. So yeah, there we go, perfect. Now if Bella had an actual herniation, and I did this, it would be really, it might not be that loose there, but you would see noticeably difference between the two sides there, saying that there is some cord compression involved there. But luckily with Bella, she's strong. All 5 pluses there, Bella, so good job there. Next, I'm going to just see if there's any nerve tension at all. So what I want you to do is bring your hand up like this here, kind of like you're a waiter. Just bring that out. I'm getting a little picky. Yep, perfect. And then what I want you to do is bring that arm out like this, and the head goes away.
Don't like.
Don't like that one?
Don't like.
Can you do the same thing on the other side?
Here?
Yep.
And then?
Yep, extend that arm, extend the wrist as far as you can, look straight at me, and then bring that right ear to your right shoulder. Not a fan of that one either?
Not happy.
So when you're doing those two there, where are you feeling the pain and discomfort?
I feel it pull from here, and then just...
Okay, so just kind of radiating down.
It just kind of goes straight.
Okay. So right now I'm checking the median nerve there, just to see if there's any tension or discomfort. Now I'm going to check the ulnar nerve, and this is how we check it here in the office. So we're going to make that OK sign. This one's a little bit challenging. You're going to make it upside down OK sign, and then you're going to bring it down, and same thing, opposite side. So I'm tensioning that nerve right through there. Anything abnormal about that? Any shooting pain down?
It's a little tingly, but not as bad as
not as intense. Yeah. Okay. Do the same thing on that side there for me. Yep. Good,
Okay,
and I'm
that
just
one
going
does-
over for video purposes
that
there,
one
like the
doesn't
two
make sense.
common ones that we see here in the office. And with Bella, it's the median nerve there. So luckily for her, make it easy, the flossing is the same thing as the, well, virtually almost the same thing as the tension test that we just did. But instead of going away from it, Bella, what I want you to do is start in this position here. Yep. And now you're going to follow your hand with your head. I know, you got to think. It's kind of like patting your head on and rubbing your belly.
That didn't I?
Yep. And it won't cause tension. Again, this is flossing, so it's tensioning that nerve root and then slacking, tensioning and slacking, just like you're flossing your teeth there. So if there is any adhesions that are up against that nerve, you're breaking it up by mobilizing that nerve. Good. All right, sweet. So what I'm gonna do here, just have a seat right here. I'm just gonna pull this forward.
But to answer
Or
your
right
question, it was recently started bothering me. And I don't think I
Okay.
did anything.
That you can think of to aggravate
There
it.
was no like injury.
I know, snowboarding season's not right
over,
now, so.
But you see it, it's all super flared up right there.
A lot of tightness. So I'm gonna have you look straight ahead at the camera there, lock eyes with them, the audience. Yep, and then go right ear to right shoulder for me.
Okay.
Good, and then just keep going back and forth. And I think Bella's being dramatic here for the video. But there are some trigger points that I'm working on, and I'm sure you can feel that kind of jump over my thumb right through there. Good. 2 more. And then 1 more. Good. Okay. I'm gonna do that same thing on this right side here, okay?
I'm all sweaty.
Activating that sympathetic nervous system.
Yeah.
Nice. That's what we like to see. What's for dinner tonight?
It is pizza night. How about you?
Get behind that. I don't know. That's why I asked you. I'm trying to think of things to make.
Ask Booney Bear.
Yeah. He eats anything.
He'll probably want some ribs or something.
Yeah. He has his first vet appointment tomorrow.
Are you going to it?
I can't.
Yeah, I was gonna say.
I don't think you've mentioned Boone in the...
Yeah.
You gotta tell him about Booney Bear.
He's a 10-week golden retriever that my fiance and I just got here last week.
Not Daly.
It's what?
It's not Dr. Daly. It's not Brady. That was a stupid joke, sorry. I was saying that you were the golden retriever.
Oh, man, that went way over my head. Sorry about that.
You got 2 blondes right here, so.
Yeah, 2 blondes. But yeah, no, he's been good. Good, and last one here.
Aye.
Good. Okay, go ahead and rotate your head side to side.
Seated?
Yep.
Okay.
Let me know pain, tightness, that kind of thing before I adjust you. All good?
No.
Let's go face down.
Yes! Crack it out of me, please.
You have any low back pain here lately, Bella? Or has it all just been kind of focal to the
mean,
neck and down?
A little glutey stuff, but nothing like mid back or low back.
Okay. Deep breath in here, all the way up. Do some stretches here. When did that happen?
What?
Like the glute pain?
That's been on and off bugging me. It kind of depends on how far I've run.
Mm-hmm.
Last night, I tried to go for like 6.5, but my
Oh yeah?
right hip kind of stopped me at like 5.
Okay.
I got kind of like a sharp pain, and then I just walked.
Are you signed up for any races this year?
Mm-hmm.
Yeah? Which one?
Got a couple. I got one down in South Carolina that we're doing.
Nice.
I'm
Keep
running
up on your
one in Bethany.
Running festival?
July. Mm-hmm.
Okay, nice. Half marathon?
Yes.
Let's go.
And I think Warren's trying to get me to sign up for the one that's coming up.
Oh, the Baltimore 10?
We'll see how that goes.
10 miler, yeah.
We'll see how that goes.
Drop that shoulder. Good.
Oh, that was the side.
And then we go into your side facing me here, please. You got it. Bella here's a veteran. You've been going to chiropractic for how many years now?
Forever, I think.
Forever, I think.
Forever, I think.
I think it's been 9 years solid.
Wow.
9 years solid.
Goes right through there. Yeah, good. Wow.
Saw Dr. Jeff when I was 10 years old.
10 years old. Same thing on this side.
This is what happens when I wake up at 4:30 in the morning.
And right through here. Yep. Nice.
Do you jump?
I have a little jump in it, yeah.
You put a little hop in there?
Well, I put a little hop into it.
Put a little hop in there?
Yeah. All right, Bella. You go ahead and face me. Same ranges of motion here. Yeah.
My tingles are better.
And then straight down. Good. And you said reaching over your head. Okay.
They're
Do you
not-
feel any, like, is it decreased in intensity? Is it still there?
I
or?
can kind of feel it here.
Okay.
Like just a slight tingle, but I don't feel anything up here right now.
You don't feel anything? Okay. So continue those nerve pulses that we showed you there, like do 2 sets of 10, okay? And then I also would give Bella some additional exercises to help out with that nerve
The nerve.
that you've been going.
The
Yeah. What
nerve.
nerve is it?
My median nerve.
You got it. Nice. Awesome, guys. Well, if you have a condition like this or have any questions about what we do here at the office, please comment, and Carly will be right on it here in the videos there. Anything else, Bella, for the channel?
No.
Awesome. Well, thanks for watching as always, guys, and until next time.
Hey everybody, this is Mike from Kalkstein Chiropractic, your Towson, Baltimore area chiropractor. Today I've got Amelia with me. This is going to be another Shockwave video, but I'm just returning from Atlanta, Georgia, where there was a little bit of a Shockwave conference. So not only do the doctors here get continued education, but the CAs as well get some continued education. We've got some fun new things we're going to try. Basically overall makes the treatment a little bit more effective. Like you've seen in previous videos, we already were getting some really good results from the radial pulse Shockwave, but with this continued education, we're really seeing just overall, you know, today we're going to be focusing on shoulders and neck, but overall we're seeing a lot more successful cases with the Shockwave with our new techniques. So we're going to go ahead and jump into it. We won't do too much about the science behind the Shockwave. We've talked about that 100 times. You can watch some of the other videos. We'll just kind of talk today specifically about Amelia's treatment, how she's feeling throughout the treatment. This is her first time getting Shockwaved, so just like some of the viewers, you know, when you guys come in and find out about it for your first time, this will kind of give you an idea of what that's going to look like. So we're going to go ahead and just start by probing around the area that we're looking for. We already know that it's going to be mainly on the right side. We're looking at our shoulder blades right here. We're going to be going under the scap, kind of around it, up into the traps, and we're going to even focus a little bit on the suboc, kind of right, that plate right under the skull here where my fingers were. So I'm going to just take my hands real quick and kind of probe around, see what muscles are really tight. Like on Amelia right here is really, really tight. Feels like she's got a knot in there. So we're going to blast that away. A little bit in the shoulders as well. That feels pretty tender too, doesn't it, Amelia?
Yeah.
Okay, and now how about up under the scap itself? Do you feel much in there?
That's okay.
Okay, so
Not too
a lot of our
bad.
care today is going to be right here where my hand is, kind of in that trap, in that suboc, the cervical region. But again, we're going to show a little bit of love down there as well in that scap. So Amelia, just make yourself comfortable. You can find a good spot for your hands. And like I said, we'll be doing Amelia's first Shockwave today. Are you nervous at all, Amelia?
Yes.
What do you think it's
No.
gonna feel like? You've heard this thing operated 100 times in the office. What do you think going into it it's gonna feel like?
I guess like a really deep massage, or like a Theragun, you could say.
Okay, yeah,
But,
that's
yeah.
definitely how it's gonna start out. But
Yeah.
like we've kind of talked about before, you know, it's gonna get a little bit more intense than that. So just try your best to remember that we're looking for about a 5 or a 6 out of 10 for pain and pressure.
Okay.
A lot of people think it's like a no pain, no gain sort of deal. We don't
Yeah.
need that. in terms of overall effectiveness, we want to keep patients, we want to keep Amelia coming back for continued treatment. So 5 or 6 out of 10 is that perfect level.
Okay.
All right, so this will start off pretty light, and I've already got the settings entered already, so just let me know how that feels.
Oh, wow, okay.
What are you thinking?
Ooh. That's interesting.
It's pretty interesting, right? Like I said,
Yeah,
it kind of
it's
starts
different.
off like a Theragun, right?
Yeah.
Okay, so this is kind of the worst of the worst up in this area. Is that worse than like that 5 out of 10? What would you say?
Yeah, probably wouldn't go up
Okay,
in
gotcha.
the neck area.
So we've already got a pretty good starting point here for Amelia. And now one of the things that we're going to do that's a little bit different, if you've seen in those other videos, we did kind of a broad painting the picture where we really just attacked the whole region. We're going to spend more time just specifically on those knots that I was feeling around for. If this was a treatment with one of our normal patients, you would be on this table after receiving some soft tissue work with one of the doctors, so the muscles will already be nice and primed. The fascia of the muscles will already be moving across the surface of the muscles, navigating really well. But, you know, just for the sake of the video, we're going to go ahead and jump right into the Shockwave treatment like so. Now, Amelia, how do you feel after we've already attacked this spot a little bit? Did you notice it kind of got desensitized on you?
A little bit, yeah.
Perfect. So what I do now is I'm going to go ahead and slowly turn up the pressure just a little bit. Again,
Okay.
she's already at about a 5 or a 6, but since we kind of hit that moment of desensitization, we can crank it up just a little bit more. And that's why we say you don't need to do a no pain, no gain, because I'm going to slowly turn up that pressure throughout the treatment. So let's talk the scalp region, Amelia. Where are we feeling sensitive at? Are we more in this area or a little bit higher up around here?
I think the first one.
Okay, so do me a
inside.
favor, and we're going to wing out that scalp, and now you can really see on Amelia, we've got that shoulder blade poking out, and so we can kind of go right up under the shoulder blade and really blast up under the scalp. So how does that feel, Amelia? A little bit tender there, right?
Yeah.
Perfect. And so what I can do then is play with the angle, and so as we're keeping points of contact with those little bit of turning, we can really change how we're attacking the muscle. All right, so how are you right here? Not too bad, right?
It's okay. A little tender. Like
Okay.
right there,
Right
yeah.
in there, yeah. Is your arm comfortable in this position? Mm-hmm. Perfect. So would you say the treatment so far, our worst spot has been up in the neck?
Yeah.
Okay.
Definitely.
Gotcha. Well, let's go back up into our worst spot. Obviously, that's going to be our target area for the video.
Okay.
I'm going to just relax your hand there. And now, I haven't gone as much down into our delt region. Are you feeling anything tender up in this spot? Mm-hmm. A little bit? Okay,
Yeah.
perfect. So let's go ahead and recruit some active range of motion now.
Okay.
What I want you to try to do is shrug your shoulders, there you go, and hold for about 3 seconds, and I want you to lower down. 1, 2, 3, and back down. And let's repeat that 5 times. What are you feeling when you're going through that active range of motion? Does it feel a little bit more intense for you?
Yeah. It
Perfect.
does.
And so what we can kind of think about as we're doing this active range of motion is it's very similar to a pin and stretch technique because we're essentially using the head of the radial pulse shockwave to pin down the muscle as Amelia walks her body through that stretch or that active motion, like the shoulder shrug that we're seeing here. And you can really kind of see all the muscles tighten up, which again lets us attack it a little bit differently. We want to make sure though that we never go over the bone, so that's why I kind of stick my hand around and just make sure as we're finding those new trigger points, we're always staying away from those bony regions, like up in here, and just anywhere, you know, spinal or any kind of bone. We don't want to go over across one. Alright, so Amelia, for the last little bit of our video, I'm going to go into the spine, or the cervical spine. So we're going to go up into the suboc.
Okay.
So I'm going to just change the head that we're using. Like you guys can see on this video, this head is a pretty wide one. We use it to attack larger areas that have a much bigger diameter when you're talking the muscle. But since we're going to be attacking right along here, that very thin kind of muscle that's right under that bone, we don't need something so big. That's just going to end up a very uncomfortable treatment. So we're going to change the head, and this will not only allow us to bring up the pressure a little bit more because it's not as big in diameter, but it'll also, like I said, be a little bit more on par with the area that we need to target here. So we're going to...
Can you show the camera the tip of it?
What's that?
Can you show the camera the tip of it?
Yeah. So just as a comparison, you can kind of see it's not nearly as wide as that other one. Alright, so just going to change our settings real fast here, and we'll get things started again.
How doing?
Oh,
Amelia, how are you feeling so far after we finish the shoulders and that scapula region?
very relaxed.
Does it feel like the muscles have kind of loosened up a little bit? Because I can
Yeah.
even feel this knot that we found earlier in the video that was kind of right there. Do you feel that it's really... I mean, there's a little bit something there, but
Yeah.
it's not really as significant, huh?
Yeah, definitely.
Perfect. Okay, so again, we're just going to be right under this bone here, and we're going to actually follow all the way up until where my finger is, so almost all the way to the ear itself. Now, Amelia, let me know,
Oh, wow.
is that a little intense,
Yeah.
or did that just surprise you?
Maybe a little too much.
Okay, let's lower it down just a
okay.
tad.
Okay.
And it's a little surprising, but this is more tolerable, right?
Yeah.
Perfect. Again, for everyone in the audience and even Amelia, you don't need to go above that 5 or 6 out of 10. And we kind of saw Amelia jump in the video, so that's a pretty telling sign that it's a little too much. Now again, I'm just using my hand to make sure I don't go over any bones, just to not only treat the targeted muscle, but we don't want it to be too uncomfortable. So where does it feel like it's the most intense? Is it closer to the center, like up in this region, or is it closer to the
I
ear?
think like right there.
Right here?
Yeah.
Okay, so again, we're going to kind of play with the angle. And you can kind of see Amelia tightened up a little bit if you watch those shoulders move. So I can tell that this angle that we have here is a little bit more intense, and we're attacking the area we need to be, as opposed to here, we don't get that reaction. So that's why it's important to kind of, once you find your area, you're reading the body, kind of looking for where we're getting those reactions from. Is that a little too intense right there? Are you okay?
It's okay.
Just surprised you a little bit?
Yeah.
Okay. Yeah, and to Amelia's credit, this is not a comfortable spot to get Shockwave. Again, it's not supposed to be the worst pain in the world, but
Yeah.
it's just not a comfortable region. However, the Shockwave definitely feels better than how tight the muscles were previously, doesn't it?
Yeah.
Good. Alright, so I'm going to drop down a little bit lower, and we're going to angle it right there, because I can feel that's where she's tightening that shoulder. We're going to kind of attack that knot that she had one more time, but now we're just using a little bit smaller of a head, because we're kind of right on top of where that knot that Amelia had that was real present at the start of the video. So how are you doing so far, Amelia?
It's getting less uncomfortable.
It's starting to get even less uncomfortable?
Yeah, like it's getting easier.
Perfect. And that goes back to that desensitization we were talking about earlier, where causing microtrauma, which is bringing in a new inflammatory process to the muscles. But with that, it's going to give you a lot of fresh oxygen, fresh blood, and even some stem cells into the area, and that's going to overall promote that healing like we've talked about in previous videos. But Amelia, let's go ahead and wipe you off, and then I want you to kind of go through a couple ranges of motion. So, we'll have you lift your arm to the side, we'll have you do some shoulder shrugs again like we did previously in the video, and just kind of tell the audience how you're feeling in comparison. I've got you kind of wiped up now. I know you're still a little sticky, but let's go ahead and do that for now. So I'm going to step to the side, and let's have you, do some arm raises. We can kind of engage the scaps and the delts, and just kind of see how things are moving now.
Okay.
Does it feel a little bit looser, not as restrictive as earlier?
Yeah, it definitely feels looser.
Perfect.
Yeah,
and
definitely.
like we talked about earlier too, we were really focusing on the regions that we kind of felt at the start of the video. That's why I was using my hands to kind of locate where on Amelia needed to be needed to have the most energy or the most output from the machine on. But again, we can do this for any region, calves, plantar fascia, heel of the foot. We can attack really anywhere that's just not a bone. So if you guys have any questions, post some comments for us. Come on into the office if you want to try it yourself. We're located here in Towson, Baltimore. But yeah, we'll film some more videos, and we'll get some more people shocking. We'll see you next time, guys.
Hello, Baltimore. It's Dr. Jeff Kalkstein, your Baltimore area chiropractor, and I'm with Bill here. Bill, how long have you been coming to the practice?
Probably 35 years.
35 years, yeah. Yeah, off and on, right?
Off and on, not regularly.
Yeah, yep.
Only when needed.
Only when you get a flat tire.
Right.
He's back, he has a flat tire. So you get a couple flat tires, right? You have one now up in your neck, right?
Right.
And how's your back doing?
Back's doing well now.
Yeah, so that was a little sore when you first came in, right?
Yep.
Yeah, okay. So how did you aggravate your neck?
Not really sure. I think I spent too much time sitting at a computer and too
Yeah.
tensed up, and
Yeah.
it's not an injury, it's just a...
So when were you last well? Or how long has this been bothering you most recently?
This probably started 6 weeks to 2 months ago.
2 months ago. And how about the back? How about that? When did that bother you? More recently?
Well, I've been coming back here now for about 3 weeks, I guess.
Yes.
And it's been good since you adjusted.
Since adjusted, yeah. So to me, people have acute problems, or they have chronic problems, they have acute flare-ups, right?
Right.
Your neck is a chronic problem, or is it just something that...
No, I would say it's chronic, 'cause
Chronic.
I've had it before.
Right.
And same with my lower
Low
right back.
Yeah. So let's do this. Go ahead and face Carly a little bit this way, so she can see. Let me see you turn your head to the left for you. Okay. All right. Yeah. Any pain anywhere?
No.
No. Now turn towards me, please. Any pain anywhere?
Yeah, it's tight. I can feel it pull.
What side?
Right side.
Right side. Yeah. Now look straight ahead and bring your chin to your chest for me. Any discomfort there anywhere?
I feel a little bit of that knot in the right side.
Like
Yeah,
is it
Mhm.
up in this area, or is it more down in this
No,
area?
it's the first place. It's
Right there, yeah, okay. And now go ahead and look straight ahead. Now let's look at the ceiling. Bend your head backwards for me. Does that bother you at all?
No.
No. Now look over your right shoulder for me this way. Does that bother you at all?
Yeah, I can feel it pull there.
Let's go back the other way. And does that bother you at all?
No.
No. So one of the things we always do, and this is a sort of the dog and pony show, so we're always trying to figure out what's generating the pain. And the options could be for musculoskeletal, it could be a muscle, it could be a hinge that allows movement to occur, or it could be a disc. And so this dog and pony show is to kind of rule that out. And obviously he's been here a few more times. And so I think Bill primarily has irritated his facet joints. Those are the hinges that allow motion to occur. And as a result of that, the muscles are compensating for that a little bit. So we were adjusting only, and we were doing some soft tissue. We tried a couple sessions of dry needling, and most recently we put on, we did some class 4 25-watt laser on that. So what I'm going to do right now is I'm going to adjust them first, and then we'll stand back up, we'll check your range of motion, see if that changed at all, and then we'll go do the laser. Is that all right?
Okay.
We'll do adjust, soft tissue, and then laser. I'm saving the laser for last, because sometimes when I do the soft tissue, it's sore, right?
Mm-hmm.
And how's it feel the next day, though?
It gets looser.
Loosen a little bit, yeah. So I'm gonna disrupt the tissue, and then I'm gonna calm it down with the laser. That's what I'm gonna
Okay.
do, okay? So, and with Bill, I sort of adjust him sitting in the chair. So Carly, I'll let you come around to the head of the table, and Bill, you can safely sit down here for me, please. Yeah. So we're just gonna drop your head here. I'm gonna tilt it just like this. And drop your right shoulder. Good, stand up for me now. Now, if you could just, no, face Carly. I'll face her, I want to see something. Go ahead and turn your head to the left again now. Yeah, now go back to the right. Yeah, how's that feel?
A little bit, a little
better.
loose. Yeah, a
You
little
you feel like it goes a little further?
yeah.
Carly, what do you think? Did it went a little further that way? I mean, you guys have a better angle than I do right now. Okay, so now lie on your back for me. There's just a couple different ways to skin a cat, and I just think when I adjust Bill and people that have this condition, if I adjust them sitting in that chair, I get a more fruitful response. So now we're going to go into this direction. Again, the key for this, just let your head sit there. Beautiful. By the way, did either one of those movements cause any discomfort at all?
No, it don't hurt.
Yeah. It looks like it might hurt, right? But you're good, right?
I mean, you sort of hear that, the noise, but it doesn't hurt.
Yeah, so sometimes when they're in a lot of pain, what I'll do is this. We don't have it in this treatment table doesn't have it, but maybe we'll show them on the way out to get to the next spot. So go ahead and step off for me now, and I'll let you go face down because I do want to adjust your mid back too. I think that's important. When we have neck issues, if we can get in there and get some of that thoracic spine to move, it also produces fruitful results too. So take a nice deep breath in and let it out. Beautiful. Deep breath in. One more time. Let it go, Bill. Let it go. That's awesome. Now go ahead and step off. And I want to see the results this time too. So step over here for me. Turn your head left. Yeah, that's much better. Now go back to the other side. This way. There we go. So I block him there. I don't want him to cheat. I don't want to turn his thoracic spine when he's turning his neck. So if you loosen up this for me and have a seat like right here, we'll start to do some of that soft tissue work. Right? I'll let you slide through there. So we use a product called Hun's Honey, and this is a shout out to where my sister-in-law Sarah Batley works. It's a great foundation, and it's a tremendous product. It's like a lip balm. It's a little bit more expensive than what we were using, and I'm not talking about a lot more, but the quality of the product is so superior to what we had before. So again, that's Hun's Honey, and so what I've done is I prepped Bill, and I put a layer of that on that upper trapezius, some of his right side paraspinal muscle, and his levator scapula, and I would tell you though, Bill, from this is probably the 6th time we've worked on you, something like that maybe?
Mm-hmm.
Yeah. That trigger point or that knot is not as prominent as it was before.
No, I can feel that, but it's still that track you just went on is really the one
that gets
feel
you.
it.
Yeah.
It's not painful, it's just you can feel the stretch, which
Yeah, and I think a lot of people get like this because of their daily activities, whether it's with a computer or a phone.
driving.
Exactly, driving, and yeah. So then we're going to put a little motion to it. We're going to shorten the muscles on that side. We're going to trap that muscle under our fingers, and we're going to make that muscle get a little longer, and then pass it that trigger point or that knot under our fingertips or under our pressure. Tell me if that's too much, please.
Fine.
Yeah, so I'm just doing his upper trap right now, and I come right up to his cervical spine, shorten the muscle, then elongate it. So some people call this a pin and stretch, and some people call it ART or active release technique. And again, it fits into the model of what happens to people musculoskeletally. Now I'm going to come back and get his levator scapula. So Bill, look up at the ceiling for me, turn your head to the right, and then again, we're going to take our chin and we're going to take it to our left knee. So go ahead and you do the motion for me all the way down. Right. So we talk about this, whether it's disc, joint, or muscle. In his case, we got joint dysfunction. It doesn't move very well. That joint becomes irritated, inflamed. There's a sensory nerve that goes right to the hinge or the facet joint that communicates to the brain, says, hey, I don't like this. The brain says, ouch. And then it sends compensatory signals down to the muscles around that area. So now the muscles start to go into maybe a protective mode, right? And if you can get the joint to move better, reduce the inflammation, and get those muscles to relax, you're going to help a lot of people. This feels 50% improved. Just the muscle tone I'm talking about, not his overall condition, just how the muscle feels to me. Okay, without me helping you, you do it. Go ahead all the way down. Chin. There you go. Beautiful. Okay, so that's good. Now go ahead and stand up for me. And I always like to see this. I want to find out what's working, what's not working. You focus on Bill. Go ahead now, turn your head to the left for me, Bill. Oh yeah, that's really good for you. Now go back the other side. Okay, see, that's much better too. Yeah. Okay, that's how's that feel?
When I get as far as I can go, I don't feel the pull right now.
The pull. Yeah. How did it feel when I adjusted your mid back? How's that feel?
That I like. That feels.
Yeah. That really takes a lot of tension. You know, because everything, your head's falling forward. All the, as the farmers would say, all the leaders or the muscles in the back of your neck are working. They're attaching down there. It creates so much lack of mobility, which really creates problems. And Bill's a golfer. If I can get his mid back to move, he's going to hit the ball 10 yards further, right?
I hope 20 maybe.
Okay, so we'll pause right now. Then let's go over and let's do the laser. Do you mind if we show people how that works? Yeah, that's good. Let's go.
And we're back. And we're back. Back at it again with another video. Bill, is it your left or right side that's bothering you?
Right.
Right side? We're doing laser on his cervical brachial area of his neck. So we'll be focusing on this part and a little bit into the traps and a little bit down. With laser, you can either have a perfect protocol, so you can make your own depending on how big the treatment size area is and all that stuff, or you can have a set up protocol. So he's doing neck. And you have all these other options, but I don't really like any of them. Operations he did in the past were. And then we wear our lovely glasses to keep our eyes protected so we don't burn our retinas. If you wanted to know why I voluntarily put these on. So the last time we did it, we did the settings of 250, 18, 18. So we'll go into the perfect protocol and to put 250, 18, 18 in it. Hit enter, and so it'll be about a 4-minute laser. We'll hit standby. It'll beep a couple times. Basically, it's just a glass ball, just rolls over the area, and as soon as I hit the button, it'll start. It'll just get warm. It might be a little cold to start just because the ball is not been used in a while. The laser emits light. It uses light therapy, so it gets a little warm on the patient. So we always ask them to make sure it doesn't get too warm, or if the pressure's okay or anything like that. Benefits of laser: it helps with the muscles recover. It brings blood to the cells, helps bring in nutrients, all that stuff that the muscles need to recover to build better, faster, cleaner. But Is this all the areas that's bothering you, like up in here and down a little bit, Bill?
And he's done after these 2.5 minutes.
Yep. He's probably good to go unless he has any other modalities written on his treatment plan from the docs. That's pretty much it. I think you're done after this, right? Unless you have like exercises or something. Okay. The only thing with laser, like, if someone has a tattoo in the area that's bothering them, like, you might not be able to do it just because if you roll over it, it could burn them with the tattoo. So that's just one thing that we're kind of precautious about. Usually, like, scars and all that other stuff, like, we can go over. Yeah. It's not too warm, is it?
No.
Okay.
Hey Carly. Hey everybody. This is Dr. Warren here at Kalkstein Chiropractic. I'm a chiropractor in Towson, Maryland, and I'm with Crystal today. Hey Crystal.
Hi.
Yeah. Crystal's like, I've got a stabbing sensation right behind my shoulder blade. I just had a hard workout. Can you work on it? And I said, yes. Can we do a video too? And you said, cool. Thank you. I appreciate you doing that. Crystal's been a patient here for the last couple of years, honestly. We've been, well, why don't you tell us, the proverbial us here, about your journey.
Well, I sprained my ankle,
Sprained it.
and they recommended physical therapy, so I came here. And then we decided we needed to strengthen that. And then I got some hip pain, so we worked that out. And now we're doing functional strength training for the whole body to not hurt.
So ankle sprain referred over, and we work with medical providers in the area, primary care, pain management, neurologist, dentist, because we do a lot of TMJ work. And so referred over for a sprained ankle, and then she had a bad case of piriformis syndrome that came on, and we co-managed it with another provider as well. And then we've had really good results recently doing some what's called ART, active release technique, and soft tissue work, and that's what I'm gonna do on her neck and shoulder right now as well. So that's been helpful, and now she comes in and she has a personal trainer here. She's working out for 45 minutes to an hour, kind of challenging different areas that we've picked up on what's called a functional movement screen. No, it's an FMS screen. It's a term that's used for a group that kind of breaks down different movements in different areas of the body. We use an in-body scan. We look at her muscle mass and her strength and see how she's progressing along on a workout. So feeling better is the first focus, obviously, getting pain relief, if you will. And then now at this point, she's really in more of a performance type mode. And if there's something that pops up, I'm here to help her out. So just to give you kind of a synopsis, if you're still with us, on her treatment journey up to this point. And now we're gonna hang out with Crystal. Cool. Crystal, you can bring your head back for me. And then drop your chin down to your chest. Good. Steve still out working about.
He's in France.
Traveling the world.
Yeah.
Head back for me. And then head down. A long stint out there.
Yes. 10 days.
10 days.
He comes back next Tuesday.
Do they give those guys first class when they travel out there? Head back for
Well,
me?
I mean, he doesn't, because he doesn't have the status. Oh, do I do back?
I don't even get ads for first class. I don't even know what that's like. Chin down to your chest. There you go. Come back for me. Head down for me all the way. Good. What's he doing in France?
Anniversary of Normandy.
Really?
80 years. Yeah.
That's kind of probably a pretty cool situation. Did you think about going out there with him for it?
No, because the kids are still in school.
School. Oh, yeah.
One day.
And field day.
And it's field day.
Cannot miss. Well, you could have missed field day. It probably would have been. It probably would have.
Disappointed
It would
anyone.
not been a bad thing, if you will. Head down. Turn to the left for me. So we are also in the same neighborhood, so our kids get to play with each other, which is cool. And Vera is one of the kids that's awesome and is very, very helpful, relatively speaking, with getting my child to sleep on time and creating star charts and telling my daughter what is cool in this world. So I'm really grateful for.
If you need an 8-year-old life coach,
we got one.
yeah.
Like the video that you created where she like broke down the star chart like for like 20 minutes, like here's how it works. Okay, Scarlett, sit down. And my daughter watched like this entire video 3 times. 5 minutes long, but it's amazing. And she's like, again, and I was like, oh, okay, you want to watch it again? Cool, you're like really getting this message. She's like, again, she fell asleep watching it that night because she was so enthralled that she had a video directed towards her.
It was like, listen up, Scarlett.
Yeah, like this is all for you. There you go, because you're gonna take your hand out like this, okay, and then roll it behind your back. So that was if you're from an anatomical standpoint, we did the erector spinae, we just did the rhomboid minor. That's why she's pulling her shoulder blade like that. And now we're doing a combo move of the supraspinatus muscle as well as the levator scap. So hand goes behind, she slides it here. Good. We roll our hand behind. That's really good range of motion. Then this is where you're gonna feel tension. Head goes down. Perfect. And then you'll feel a little trigger point hang out right there, and then tuck your chin a little more. Good. Turn your head to your left. And there we go. Good. And come back out. Hand back out to the side. Palm up. Good. Behind. You got a little book bag over there, don't you?
That's for Michael and his babies.
Oh, that's so nice.
Word books, passing them along.
Nice. Here you go. Hand out.
I'm sure you own all the books in there.
It's cool. No books for us. I appreciate. No, I'm just kidding.
Well,
no,
I figured that
you've probably already
on your third.
You've given us already a bunch. No, we just had we had someone give us a bunch of. My daughter's obsessed with the 3 Little Pigs, for whatever reason, and apparently, the wolf for sure.
It's not the pigs for her. It's the wolf.
It's definitely the wolf. And so there's a lot of different 3 Little Pig books out there. Got them all now. And yeah, it's exciting times here at our office. There's 3 of us that just had a newborn. Michael, Alec, and myself. So lots of babies.
What's in the water here?
That's what I'm saying. Head down for me. Good. And then relax your right shoulder. Good. Is that kind of where it's a little stabby?
Yeah.
Okay. And we're going to hang out there for a little bit longer.
Stabby is the scientific term, right?
That's the only one I know. I hope it's the scientific term. A little pressure there. Good. Now let your arm, yeah, just let your arm fall for me. And then bring it around front. Good. Good. Loose, loose, loose. I'm gonna pull your shoulder and your scap. There it is. Okay. Now let it fall. Kind of get lazy here. Up. Easy. Good. And relax it all. And then let it settle. Good. All right, stand up for me. Table's gonna come on up, and we're gonna lie on your stomach. Time to relax. Yes. You can come face down. Good. So tell me about the workouts that you have here. Who do you work out with?
Becca and Christian. And I like Taylor. She's new, right?
Taylor's new. Yeah, I love Taylor. She's awesome. Becca, Christian, Taylor. We have Amelia coming next week. So we have 4 techs, trainers that are working with us over there. And tell me about your workouts.
A lot of squats.
Lots of squats?
increased the weight today, so
Are you doing the trap bar squats? What kind of squat movement are you doing?
we're doing goblet squats
Nice.
and deadlifts and a lot of lunges.
Nice.
Lunges. We increased the weights on all of them today.
Take a deep breath for me. Drop your chest and get lazy on the table. Focus on your hands sinking. There you go. Good. So that's how we treat piriformis, low back pain. She had some referred pain going down in her leg. Is through chiropractic care, soft tissue work, adjustments, and then loading through what she said, squats, deadlifts, lunges with good form, working on good intra-abdominal pressure, focusing on core strength. Combining the two, not in isolation, is really an evidence-based approach for dealing with a lot of different musculoskeletal issues. So that's the sciencey part of what I'm going to talk about today, if you will, of like being really evidence-informed and applying it in an efficient manner where we have a little bit of fun.
Oh yeah.
We have a little bit of fun. So that's my spiel for the day. I'm gonna bring this up. You're moving well. That mid back moved nicely. Does that feel okay?
Yeah.
All right. Low back pelvis feels good. Got the moves, baby. Let's go. Hey, if you need help in this area, I like helping people and I'm happy to help you. And then I made that. You can subscribe if you're not in this area just to check out videos. Thanks for watching.
Hey guys, Dr. Nick here with Kalkstein Chiropractic, your Baltimore area chiropractor. We're here with the lovely Bella. She, tell us your history. What's going on?
I was in a car accident. Still having some.
Fast forward.
Oh,
the
to
most
this one?
recent stuff. Yeah.
I was sick.
Yeah.
and
She was
so-
she's cooped up in bed. A lot of sleeping, a lot of lounging. So right now she's got a pretty crunchy neck. It's giving her a lot of discomfort. So we're gonna get her adjusted, get her moving better, and she's gonna feel good. Feel good. Cool.
Sounds good to me.
Stomach first. You really were about to tell us your life story.
I was. You said?
Well, the most recent
Oh,
chapter in the life that is Bella.
crunchy neck.
Ooh. Making this easy, Bella. Breath in. Take it all the way out. Good. Another breath. And out. Good. Go ahead and flip over onto your back now.
That was a good one.
So you're sick during the holiday.
I know. I
That's
had to
the
have
worst time.
Thanksgiving
Go
on
about that.
the FaceTime. So.
Did they at least bring you food?
They did, but it didn't taste the same. Like, it was like my apple pie. It wasn't my apple pie.
Are you an apple or pumpkin?
Both.
Both? Which one do you like more though?
Probably pumpkin.
Ooh, wrong choice. Apple
Well, you've
pie's
never
better.
had my grandma's.
Apple pie, historically, better. Especially with that vanilla ice cream. Ooh,
Fair.
I'm in
fair.
heaven. Alright, a little pressure here. Nah, don't help me on this. Relax the neck. Good. Relax there. Bella, how long have you been coming here?
Like, forever.
Yeah, I know. Wiggle your right big toe.
Wiggle your right face.
You're pretty bad at that. Alright, Bella, step off and face me. Look all the way up towards the ceiling. Good. All the way down towards the ground. Good. Straight ahead. And then look over each shoulder. Okay. So, she moves pretty well, but she still guards a lot with the muscles. So let's do some needles next if you're up for it. Sound good?
Oh, perfect.
Guys, thanks for watching. If you have any questions, comments, concerns, leave them down below. We'll be happy to answer them. Otherwise, thanks for watching. We'll see you next time.
Do that retraction backwards. A lot of our patients will want to overextend the neck forward, almost like you're a turtle kind of coming out of its shell. So we don't want to do that. We just want that nice retraction and then return to normal. Hey everybody, this is Mike. Kalkstein Chiropractic. I'm here with Tanisha today, and today we're going to be looking at some McKenzie's or some functional movement patterns. We're going to be focusing the video today solely on the neck and the low back But again, we can do McKenzies for basically every joint that we have. We have knee McKenzies, we have hip McKenzies. So any of those joints that you're having problems with, just know, even though this video is focused on the neck and specifically the low back, we can also help you out with that. We're just kind of going over what's a little bit more common, a little bit more popular here in the office. So today, like I said, Tanisha is going to be helping me out here. We're going to start with our cervical McKenzies. So with our cervical McKenzies, it's best to do it seated. So we're seated nice and tall. We're not slouched over. We're not hyperextended, you know, over exaggerating a proud chest. We're just at a natural, nice seated posture. So what we're going to be doing here is we are going to pretend that our head is on a train track, if you will. We don't want to go down. We don't want to go up. We want to go nice, straight, forward and back. So Tanisha, go ahead and pretend like you've never done this movement before, just so the audience can kind of learn it with us, if you will. So now what we're going to be doing is we're going to start with our retraction. So we're going to be pretending like, you know, you're at a family gathering, you've got an aunt or an uncle that you don't really care for, and they're coming up to give you a kiss. What's the first thing that you're going to do? Naturally, you're going to go, oh, exactly. So that's going to be the whole movement. We're not going to do it that fast. It's not going to be that jerking motion, but we're going to go nice and controlled. We're going to go all the way back as far as we can. And then this is the part we have to emphasize here. When we return back to the movement, we want to go to a neutral neck position. So go ahead and do that for us, Tanisha. Perfect. So a lot of times when we end up doing this, and this is why if you're practicing this at home, try your best to either film yourself or have a friend watching you or a family member, because a lot of times, and Tanisha can do it with me, when we do that retraction backwards, a lot of our patients will want to overextend the neck forward, almost like you're a turtle kind of coming out of its shell. So we don't want to do that. We just want that nice retraction and then return to normal. So Tanisha, go ahead and get a couple reps going for us, and we're going to kind of talk through this movement. So again, it's not going to be as nice as Tanisha's movement if you're in a lot of pain. Totally normal. All we're really looking for is a little bit of pressure right in the back of the neck at that full extension. You should feel it maybe in the top, maybe a little bit lower, but you should feel it somewhere in this general area, that little bit of pressure. Now, with any of our McKenzie movements, we like to operate at a red light, green light basis. So let's pretend here that if Tanisha was in a lot of cervical pain, a lot of neck pain, the way that we would do a red light is if at any point in time, if we had radiating pain down either arms that got worse, let's say it was only going to the forearm, and during one of those repetitions that pain went down to the fingers, that would be what we would call a red light, meaning we're probably not either doing the motion correctly, or we might be doing a movement pattern that is actually counterintuitive to kind of healing or benefiting the area that we're going for. So again, if radiation increases, if pain at the area or at the site of your real cause of trouble, so bottom of the neck, top of the neck, wherever it may be, if that increases at all, that's going to be one of those red light situations. Now a green light, to say, hey, even though it might not be the most comfortable, but it's working, what that would look like is, let's say we do have that radiation of pain, like I said earlier, in the forearm. Let's say it's no longer in the forearm, but it's in the bicep, or even up there in the shoulder, but it hurts worse. Even though it's counterintuitive, that's actually going to be a green light, because we're localizing the pain back to the source of pain. Now, even if it's more intense in the neck, but we're losing that radiation, again, that's a green light. We're gonna wanna keep doing this. Now, with these movements, we actually want to be a little bit heavier on the repetition side. And again, I know the first couple aren't going to feel super comfortable, but as long as we can get ideally about 30 to 40 in per day, that's gonna be really towards the goal that we wanna see. There's not an ideal repetition count, but what we're really aiming for here is just a decrease in our symptoms. If your pain is decreasing at all, if your range of motion, maybe you can't turn as well, if that's suddenly getting better, that's a decrease in symptom, and that's going to kind of be that signal of, hey, maybe you've done enough at this point or for the day. Now let's go ahead and pause the video. We've already talked about the cervical McKenzies, the neck McKenzies. We're gonna go over to one of our bars now and we'll talk about the low back.
And let it go. There it goes, that's the one I wanted. Hello Baltimore, it's Dr. Jeff Kalkstein with Towson Kalkstein Chiropractic, your Baltimore area chiropractor, and I'm with Jaden today. We've got a special guest. Jaden goes to the Naval Academy, you're a junior? What do they call juniors?
Second class.
Second class, yeah. And he's off today because of Martin Luther King,
Yes,
right?
that's right.
Also Groundhog Day and Inauguration Day, so a big day today, a lot of stuff going on, right?
Big day.
So, so Jaden, what brought you to see us?
I was having some neck pain. I tweaked my neck a couple days ago, and last night I was just kind of couldn't really sleep.
So I should interject here. Jaden is on the wrestling team at the Naval Academy, and you felt you were wrestling?
Yeah. Just felt kind of weird afterwards. Nothing too crazy. Just felt it last night mainly.
And how many days ago was that?
That was like 2 days ago.
Yeah. How'd you find us?
So I looked on Yelp last night, and I was just trying to find a chiropractor, and I saw you guys had the best reviews, and you were pretty close by.
Close by, yeah.
Just gave you guys a call.
And you went to a chiropractor back in, he's from California, by the way. You went to a chiropractor back there?
Yeah, I did.
Yeah. You were on the wrestling team then?
Yes.
Yeah. So we brought him in, and we checked his range of motion. It's restricted going to the right. He didn't like bending his head backwards. So after we examined him, we did some trigger point dry needling, and we did some class 4 laser on the right side of his neck, because that's the involved side. How does it feel after that treatment?
Feels a lot better.
A lot better, yeah. So go ahead and look at Carly. Go ahead and turn your head to the left. Yeah. Any discomfort when you do that?
No.
No, go to the right for me. Any discomfort there when you do that?
Just a little bit.
A little bit, yeah. So do the same thing. Look up at the ceiling, bend your head back. Does that bother you as much as it did?
No, not as much.
Now look over, go back again and look over towards me. Go back and look over towards me. Does that still bother you at all?
Just
A little bit, yeah, okay, all right. Let's get you up on the table, so you're gonna lie on your back for me, Jade.
All right.
So I was telling, so Jaden walked on to the wrestling team. Did you walk on as a freshman?
Yeah.
So you've been on it for 3 years.
Yeah.
What's your weight class?
125.
125. Do you have to cut weight to get there?
Yeah.
Really?
Yeah.
Is that painful?
It's alright. It's just part of the job.
I had to do that when I was younger with football. I think it was like either, wasn't Mighty Mice, or no, it was Mighty Mice or Midgets. You got to a certain level, you had to weigh X number of pounds, and I was bigger for my age at that time, and I think I stopped growing when I got into like 8th grade or something like that.
Okay.
So you've been adjusted before, right?
Yes.
Yeah. So I want you to just relax for me this way. And I just want you to let your head sit into that cushion for me. You okay with that?
Yeah.
Let the table bring you up. Let's have you flip over on your back. When you get back to school, you should go see one of the trainers, okay?
Alright, yeah. Well, we have a trainer on. Make sure you know.
Is he specifically for your team?
Yeah.
Yeah, and I asked Jaden, do you know if you have a chiropractor?
There's no chiropractor at school.
Yeah, I used to know the guy that covered for the academy for a while. I don't know what happened to him. Slide up for me. And let your arms drop down for me. And just relax. So again, you know, what I'm looking for are those areas that are not moving very well. Take a deep breath in, Jaden, and let it all the way out. Beautiful. So I'm looking for those areas that are stuck or not moving as well as they should. Again, deep breath in and let it go. There it goes. That's the one I wanted. Stand up for me. Go ahead and step off. And go ahead and face Carly again. Let me see you turn your head to the left. How's that feel?
Feels good.
Yeah, go back to the right now for me. How's that feel?
Feels good.
Feel better than it did before I adjusted you?
Yeah, definitely better.
Yeah, it probably, what happens is you have hinges that allow movement to occur in your neck. They're called facet joints, right?
Yeah.
And the facet joints have nerve endings that go to them. It's a nerve comes off, it's called the medial branch of the dorsal rami. So when the facet joint gets locked up or tweaked, right, it starts to fire that nerve ending and it sends signals to your brain that says, hey, I don't like this down here. And you start to get a little bit of pain and your body starts to compensate, you lose some motion. So there's one exercise I really like for neck issues. It's called, it's a McKenzie cervical spine translation. And basically you'll know this. Remember when you used to have to brace up and do how many days till Navy beat Army, what the movie was? So the brace up is basically called chin translation. I want you to take your chin and pull it in like this, right? And let it go. Bring it back in again. 1001, 1002, let it go. Do it again. Perfect. Let it go. And one more time. Let it go. So you'd want to do 10 of those a couple times, right? Yeah. And because you study so much at the Naval Academy, you want to bring your book up like this so you're not looking down all day.
All right.
It'll take stress off that neck of yours, okay?
Okay.
All right?
Sounds good.
And when you get back, go see your trainer,
All right.
okay? All righty?
Yeah. Thank you.
My pleasure. Thank you, Baltimore. I know, Carly, I'm supposed to say something after this. If you like this video, what are we supposed to do?
Like and subscribe.
Like and subscribe. What else? If you're having neck pain, heaven forbid, come and see us. Thank you, Baltimore. Thank you, Jaden.
Of course.
Good.